When does ADHD become most apparent in a child? Usually by the 4th grade, people are able to detect whether a child has ADHD or not. What's required in 4th grade is a child sit at his desk, work quietly. A kid with ADHD is not going to do that. A kid with ADHD is going to become fidgety, they're going to have difficulty staying on task, and they tend to draw attention to themselves. But that tends to be male children more often than female. Little boys are the ones who tend to be more impulsive and active, and they get noticed by the teacher. Little girls with ADHD actually can sit at the desk and be quiet, although they're not doing their work, they're just daydreaming and they're distracted in another way. They tend not to get noticed. But 4th grade is where you begin to see that difference with boys. With girls, it's when they're a little bit older. You have to, let me see. With girls, it's at a later age where you notice that it's happening. Their schoolwork isn't getting done. They're not really, you notice them not paying attention when they get into the 5th or 6th grade. That becomes more of an issue. Why is it critical to diagnose ADHD in a child? Because we don't want the child to fall behind in schoolwork or to be slow down in social development. ADHD can distract people from the developmental issues that need to take place in their lives. So by diagnosing it, you allow the child to keep up with the schoolwork, keep up with the learning, and then learn the social skills that are necessary for them to have for the rest of their lives in handling this. People generally don't outgrow ADHD. That's a fallacy in people's minds. It's for children. It isn't. It's for adults as well. 70% of children grow into adults that will continue on with the symptoms of ADHD. So it's important to diagnose it early so it can be worked with. There are several ways of working with ADHD. The first would be using stimulants as a medication. And there are 3 kinds of stimulants that are most popular right now. That's Ritalin, Adderall, and Concerta. There is a non-stimulant called Strattera. It is very promising right now, but there isn't a whole lot of data out on it yet. So the other 3 are more readily relied upon. What you want to do for a child socially is to create structure for this child so that the child stays on task and learns the methods of staying on task. One of the things I do with very small children when it's helping them with ADHD is telling them to think slow like a turtle. And I found that actually giving that to adults as well works. And how does a turtle move? A turtle goes into its shell and it comes out very, very slowly. So think very slowly. And when you get them to think very slowly like a turtle, they find themselves creating some boundaries, creating some structure, and then able to get back onto task. Their minds are racing so fast, they have to come up with a way of slowing it down. And the vision of a little turtle sometimes is helpful. Well, there is another medication out called Strattera. It is a non-stimulant. It's a non-stimulant-based medication. It's rather new. The jury is out yet on its effectiveness, but it does look very promising. Where can I go to find out more about ADHD and treatment options? There is an organization called CHADD.com, and it's spelled CHADD.com. They're a wealth of information for people who are interested in knowing more about ADD and ADHD.